Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing about another DABT topic, that is ethanol. Ethanol is a very huge topic. So with respect to ethanol, different types of toxicity which are associated with ethanol I will be discussing. So in this video we'll try to cover about frank toxic effects, fetal alcohol syndrome and alcoholic cardiomyopathy. Most of the literature is taken from Clayson short textbook only. So in reference to that, you can also read Clayson 9th edition full textbook will be there. No, that also you can read. Alcohol in detail it is given in this particular chapter 24. That is toxic effects of solvents and vapors. Okay, so let's directly dive into the topic. Many humans they will experience greater exposure to alcohol. Alcohol you can say, ethanol you can say. Okay, than to any other solvents. So if you look into this particular chapter, no, chapter 24, you have under alcohols, you have ethanol, that is ethyl alcohol, then you will have methanol, then you will have isopropyl alcohol. These three alcohols that will be discussed in this particular chapter. Okay, this video will restrict to ethanol. Ethyl alcohol is used as an additive in gasoline, as a solvent in the case of industry. That's why if you see into ISH Q3C, this particular alcohol has been listed as class 3 solvent with permitted daily exposure of 50 mg per day. Okay, commonly used as solvent. Why it is used means chemistry is there with respect to ethanol because of its polarity. That another video will discuss about it. Why it is used as a commonly used industrial solvent. Next, in many household products, pharmaceuticals, hand sanitizers, and in toxicating beverages. You might have seen during COVID also, people were it was much recommended that please sanitize your hand because most the greater percentage of this sanitizer composition used to contain alcohol, which is a disinfectant. Okay, frat toxic effects are less important occupationally than injuries resulting from psychomotor impairment. So with respect to risk assessment, no, you have different point of departures will be there. For example, you have NOEL, low L. So similarly, FEL is also there. FEL is nothing but frank effect level. So what is frank effect level? I'll discuss in another video. Okay. So when you look into this alcohol, no, whenever any severe types of toxicity, irreversible type of toxicity is associated, that type of toxicity will be categorized as frank effect level. So alcohol, you have moderate type of poisoning is there, excessive alcohol poisoning is also there, but before alcohol reaching into higher concentration and causing irreversible type of adverse effects, more threat we have with respect to psychomotor impairment. Okay, so driving under the influence of alcohol is a major cause of fatal auto accidents. That is the reason it is very much restricted that no driving when you consume the alcohol. Blood alcohol level and the time necessary to achieve it are controlled largely by rapidity and extent of ethanol consumption. This is again very very important. Any chemical when you read, no, you have to see the kinetics. Okay, how often you're taking it, that is consuming, that is exposure, how much amount, what is the time. Okay, then how much it is getting metabolized, how much it is removed out of your body. So these all factors will determine how to mitigate that particular poisoning. So similarly in the case of ethanol also, how much amount you're consuming and how much it is getting metabolized, how much is getting excreted. This is also very important parameters. Okay, so blood alcohol level is very very important. That is the reason when if you look into the officials, police officials, what they do, they keep checking your breathing. They will check alcohol concentration in your breath. So that is the reason. One other reason you can say that alcohol get expired through three different routes. Here it is given. See, the alcohol is eliminated by urine, excretion, exhalation, and metabolism. Okay, ethanol is distributed in the body water and degree in adipose tissue. So always there are certain chemicals which distribute through. They'll go and bind to the tissue. They go and bind to the adipose tissue also. So alcohol also similarly. The alcohol level in blood in an average adult decreases by 15 to 20 mg per deciliter per hour. So this is the what do you say, the blood level, alcohol blood level. So a person with a blood alcohol level 120 mg per dl would require at least 6 to 8 hours. You have taken alcohol at least after 6 to 8 hours. It has to, if you want to eliminate completely zero from your body, it will take another 8 hours after consuming the first alcohol. So if these are the alcoholic poisoning symptoms, you can see excessive confusion, then you have seizures, then you have slow or irregular breathing, then you have hypothermia, that is a decrease in the body temperature, then you have pain or bluish skin, okay, then you have severe convulsions, vomiting, then unconscious or inability to wake up, then you have extreme super choking or gagging. That is the reason when your emergency situation is there, in order to tackle the choking when alcohol is consumed, you have to lay the person to the side. So we'll see about how to mitigate that thing also. So this the particular diagram, it is very clearly explaining about the potential long-term effects of ethanol. So we have on large consumption, which are generally bad, and these are small to moderate consumption, which are supposed to be good. I will not discuss good parts because I am not in favor of alcohol. This thing. So upon large consumption, we will see. What I request you, pause here and read yourself, because this is a very good diagram which they have very clearly laid out based on different organs how the alcohol is having adverse effects. So important thing I want you people to remember is about Wernicke's syndrome, because it is a combination of two different things where brain neurotoxicity is there, and Korsakoff syndrome is something related to motor impairment or confusion or memory loss. So these are the two different symptomatic conditions which together they are known as Wernicke's syndrome. So please go back and read this in detail. Okay, then also understand upon alcohol consumption, you have different types of cancer like mouth cancer, trachea and esophagus cancer, liver. Chronic consumption will cause cirrhosis and hepatitis. Okay, so pause here and try to read psychomotor cravings, which we understood. All this thing, irritability, depression, anxiety, psychosis, hallucination will be there. Okay, then upon effects which are linked with both simple and large consumption also they have given on which organ it is going to have an adverse effect. So now we'll read one slide with respect to what is frank toxic effect. Frank toxic level I will discuss, FEL I will discuss at the point of departure in another video, but today we are restricted to frank toxic effects, which is given in the textbook only. So if you look into frank toxic effects no, of ethanol are referred to severe, clinically obvious manifestation of poisoning. So based on the severity of the toxicity, that critical toxicity, this particular terminology is given, frank toxic effects, irreversible type of damage. Okay, that you have to keep it in your mind. These effects typically involve profound depression. Means there is a decrease in the respiratory breathing rate, profound depression of the central nervous system. At the present, it's a medical emergency. To such patients, you have to, it is a severe, a physician need to be addressed to the patients. Okay, severe ethanol intoxication symptoms. What are those symptoms? We'll see. Clinical signs of severe ethanol toxicity often include psychomotor is there, which is not, it is severe upon once the after 8 hours alcohol gets eliminated from your body. So those type of psychomotor effects we have seen. Now we are discussing frank toxic effects, which are severe type, where emergency physician need to be addressed to these patients. So loss of consciousness of coma, severe respiratory depression, okay, decrease in complete completely slowing of your breathing rate. This you see in the case of morphine poisoning also, fentanyl poisoning also, respiratory depression will be there. Dangerously slow or shallow breathing, hypothermia, that is dangerously low body temperature, severe loss of motor coordination, inability to stand, that person will not be able to stand, risk of aspiration from vomiting while unconsciousness. Okay, then so this is a very beautiful graph they have given. So you pause the video and go through here. This is the blood alcohol concentration. So as the alcohol concentration is increasing, adverse effects are there. People assume that upon consuming alcohol you have beneficial effects, but that is not completely true, and it has not been proven completely by the researchers. So there will be depression. There will be a decrease this thing. There is a severe dysphoria, depression type of effects are there upon alcohol consumption, or whenever the alcohol concentration in your blood keeps increasing. Severe intoxication, what are the clinical implications we'll see? Severe intoxication occurs when blood alcohol level reaches to a point where body's vital functions are compromised. Here, what are the body vital functions? brain it is affecting, and it is affecting your lungs, respiratory depression, severe respiratory depression. The specific concentration at which these effects appear can vary based on the individual. Yes, this is a very common thing is there. Every individual, his response to the alcohol metabolism or alcohol poisoning is little bit different. Males are different, females are different, Caucasians, Asians, and African, their metabolism is different. So that part we will be learning in this particular video. Based on individual factors, what is that factors? It's body weight. Fat people, they will metabolize alcohol in a different way when compared to thin people. Metabolic rate and personal tolerance. Certain individual might have more tolerance towards alcohol, and another individual might have less tolerance towards the alcohol. However, reaching these levels is life threatening and require immediate clinical intervention. As we know, these type of are comes under the category FANG toxic effects, irreversible type of severe respiratory depression. Okay, so how you can do is keep the person on the ground in a recovery position on their side. This is what we are saying. Why? We're trying to stop the choking, okay, which is a severe type of effect. Another very important, which I also keep saying that do not leave the person alone. So any person who is having poisoning symptoms, whether it is drugs or recreational drugs or alcohol, don't leave the person. Any close friend or a relative or a family should be accommodating with that person. Never leave that person, because the person might undergo depression. He might attempt some kind of suicidal, or he might do something because of he's not a conscious awareness. So a person assisting with that person should be there. Okay, let's now learn about the metabolism of this particular alcohol. So we have ethanol is metabolized by, we have to remember three types of enzymes: ethanol metabolism, methanol metabolism, isopropanol. This is very important. Isopropyl alcohol, very important. Okay, so alcohol dehydrogenase, this is the primary enzyme. Okay, ADH. Here we'll discuss only ethanol. This part catalyzes oxidation of the most of the ethanol to acetaldehyde. So ethanol, upon action by this particular enzyme, what is this enzyme? Aldehyde, alcohol dehydrogenase. So what it is forming here, OH group, no, it is converted into CHO. This is the aldehyde group. Now, further this particular acetaldehyde aldehyde form, no, which is rapidly oxidized, oxidation taking place by the enzyme acetaldehyde dehydrogenase. This is ALDH. So here C double bond OH, this is CHO group, no, it is converted into acetic acid, COOH. Okay. So another important enzyme with respect to alcohol dehydrogenase and acetaldehyde dehydrogenase, there is another enzyme called catalase. Catalase, what it will do, it is utilizing hydrogen peroxide, which is supplied by the action of NADPH oxidase and xanthine oxidase, will normally account for more than 10% of this ethanol metabolism. So some part of the alcohol will get metabolized by this particular enzyme catalase. Catalase you will also come across if you see alcohol metabolism in the rodents, alcohol metabolism in the non-rodents will be different. In the case of, I'll show you one graph. There, catalase is the enzyme which is involved in the alcohol metabolism. Then we have to remember third type of enzyme, that is CYP2E1. Okay, CYP family contains many things, 450, 3A, like that. So in particularly with respect to alcohol metabolism, CYP2E1 is involved. So CYP2E1, which is the principal isoform of this hepatic, what is this one? Microsomal ethanol oxidizing system. Okay, this is also involved in the metabolism of alcohol. So let's understand in detail about ALDH activity. Coming to ALDH activity, though, it is usually sufficient. So whatever alcohol that we consume, no, whatever this ALDH enzyme, that is acetaldehyde dehydrogenase enzyme we have. See, always remember, body has a defense mechanism. Okay, any poison you we were able to metabolize some certain amount of poison, but there will be saturation to that particular amount of enzyme which is present in our body. Similarly, in the case of ALDH also, that is, we have usually sufficiently high to metabolize large amounts of acetaldehyde to acetate. So we are able to metabolize this aldehyde to acetic acid. But if you look into this type of, I told you there is a ethnic variation is there. Caucasians, blacks, Asians, they have different percentage, a varying percentage of different ALDH isoenzymes with respect to, like CYP also having isoforms is there, no? So similarly, this ALDH will also have isozymes which impact efficiently acetaldehyde metabolism. So this ALDH isoenzymes are different in the case of Caucasians, in the case of blacks, or in the case of Asians. That is the reason the metabolism in this type of different geographical region, ethnic region is little bit different. So if you look into Asians, no, some 50% of the Asians will have inactive. ALDH is there, but it is inactive form. And these persons, they have more flushing, more headache, more nausea, more vomiting, tachycardia, hyperventilation when compared to Caucasians or blacks. Whereas this particular ALDH, inactive ALDH is, often it is see double-edged type of sword, you can say. So it will prevent that individual from developing alcoholism, but because of the excessive formation of this particular acetaldehyde, no, increases the risk which is associated with this acetaldehyde related cancer. What are those? Esophagus cancer, stomach, colon, lung, head, and neck. So these are the different types of cancers which are formed because of the excessive accumulation of this acetaldehyde in your human body. Okay. So in this slide, we try to learn about the ethanol metabolism. What are the enzymes which are involved in the metabolism of ethanol, and why there is a ethnic variation? Why different types of whites, different Asians, they will different. If you look into East Asians like Japanese or Koreans, they Chinese, they metabolize alcohol in a different way. So why there is? Because the enzymes which are involved in the metabolism of ethanol are different across the different ethnic region. Even fat is different. We'll discuss about gender also. We'll see. Now see this in this slide. We'll discuss about the gender. Gender differences in response to ethanol are well recognized. So it is well proven. Well, we have enough literature where it is clearly states that males are metabolizing the alcohol in a different way when compared to females. So we'll see. Females exhibit slightly higher blood levels than men. Okay, so whatever if a male is consuming 1 glass of alcohol and the female is consuming a glass of alcohol, female will have more ethanol concentration in the blood. Okay, the phenomena is due to part more extensive ADH catalyzed metabolism of ethanol by the gastric mucosa. In our stomach, gastric mucosa lining will be there, no? In that case, in the case of males, more extensive ADH catabolism is there in the case of males. Then to a smaller volume of distribution, VD of this particular alcohol is less in case of women, because of which alcohol concentration is more in the case of plasma. Okay, for relatively polar solvents such as alcohol. So I told you, no, we'll discuss about the chemistry of alcohol also in another video. Why polarity is there, how OH electron donating group or nucleophilic, why it is more excessive, reactive. That also with respect to polar solvents that we'll discuss in another video. Women are more susceptible to alcohol induced liver, that is hepatitis, as well as cirrhosis. Okay, that is the reason a female when she's pregnant, she should not be smoking, she should not be consuming alcohol. So there will be severe adverse effects on the progeny or the baby or the fetus embryo which is developing inside her womb. So we'll discuss about the fetal alcohol syndrome in this one. So fetal alcohol syndrome is the most common preventable cause of mental retardation. So the baby who are pregnant women who are consuming alcohol, the babies will have mental retardation. So what are the diagnostic criteria? Heavy maternal alcohol consumption during pregnancy, alcohol consumption during gestation, pre and postnatal growth retardation. Okay. Craniofacial malformation including microcephaly. So small head will be formed in the case of these babies. Mental retardation because the developing young juvenile or the fetus embryo is still in the developing stage, no, so there will be mental retardation will be there. Thus complete manifestation of gas gestational ethanol exposure are referred to as. So this is something new term that you will come across, that is called fetal alcohol spectrum disorder. So what is this FASD? We'll discuss what are the important points that we need to remember with respect to textbook only. So potential mechanism causing this FSD include sim simple oxidative stress in the case of fetal tissues. If you look, the baby fetus will be there in the fetal tissue, there will be oxidative stress will be there, because of which ROS will be generated, reactive oxygen species will, free radicals will be generated. Alterations of neurotransmitter gated ion channels such as NMDA receptors. So normal functioning of this NMDA receptors is not taking place. Alteration in the regulation of gene expression with reduced retinoic acid signaling or variant DNA methylation. That's why you will come across hypomethylation also. So HDAC inhibitor, hypomethylation will be there, no, that is there. Interference with mitogenic and growth factor responses involved in neuronal stem peripheral, again which is related to neuronal signaling will be there, that one. Disturbance in molecule that mediate cell-cell interaction. The crosstalk between the cells will be disrupted. We are talking with respect to the ethanol toxicity in the case of fetus only. Okay, this then we have dearrangements of glial proliferation. That is, neuroglia will be there, no, in between the neurons, differentiation and function, because they're still under developing stage. Overconsumption during all these trimesters, that is first trimester, second or third, all during these 9 months. Pregnancy can result in particular manifestation depending on the period of gestation, to which period they are getting exposed, during which the insult occurs. Okay, at which pregnancy window period you have been exposed to excessive ethanol consumption. That, so in this video we have discussed, in that particular previous slide we have discussed about the gender differences, we have discussed about fetal alcohol syndrome and FASD. What are the important characteristics, how mental retardation, all these things in the fetus you will see if the alcohol exposed is during pregnancy. Now we'll discuss in something more detail, which is given in the textbook only. I'm discussing about the textbook, lesson textbook only I'm discussing. So human CYP2E1 is there. This is the enzyme, isoform of the CYP enzyme. Is effective in production of reactive oxygen intermediates. Okay, ROS RNS generation because of excessive oxidative stress. Free radicals which are generated, no, they causes the cytotoxicity, they causes the cell death. This is the main mechanism. Any hypothesis you write, one of the mechanism will be involved this one. We will read in the CYP2E1. So they are involved in the production of this reactive oxygen intermediates from ethanol that cause lipid peroxidation. Okay, that is, everything is taking place here in the liver. Okay, ethanol induces release of endotoxin from the gram-negative bacteria. So in the just now we have seen gastric mucosa will be there, no, endotoxin. There it is releasing. So endotoxin from the gram-negative bacteria in your gut, stomach, whatever the lining is there. Endotoxin which is taken by the Kupffer cells. Kupffer cells causing the release of inflammatory mediators. These are protective cells, no, which are cytotoxic to hepatocytes, to the liver cells, as well as chemoattractant. It will attract more neutrophils to that particular area. Okay, so inflammation taking place, that is the reason. So because of which hepatocytic cells will undergo death. Okay, so alcohol induced tissue damage. Now we are discussing about how alcohol is having adverse effects on the tissue. What if your tissue, particular liver tissue, will be discussing from both nutritional disturbances. Why? Because we have seen Wernicke-Korsakoff syndrome is, two different things together. I told you, one is, it is the second part is causing confusion. First part is because of thiamine deficiency, vitamin. So we'll discuss that one. So here, results from both nutritional disturbances and direct toxic effects, malabsorption of this thiamine. So there is a decreased absorption or interference in the absorption of this particular vitamin thiamine. So diminished enterohepatic circulation of folate. So liver will be involved in enterohepatic circulation, that decrease. Degradation of this pyridoxal phosphate. Okay, and disturbance in the metabolism of vitamin A and D. So all these functions are impaired. Okay, prostaglandins, PG, which will come across thromboxane, PG like this, released from the endotoxin activated Kupffer cells. Here we have already seen that endotoxin is taken by the Kupffer cells, may be responsible for hypermetabolism. More the metabolism rate is increased in the liver. With the increase in oxygen demand, because of the oxidative stress, viability means the cell survivor of this liver cells, centrohepatocellular hepatocytes. If you look into histopathology of the liver, you have a triad will be there, where centrolobular one this thing will be there. So that particular viability of that particular section of cells is impaired, would be most compromised due to their relatively poor oxygen supply. Oxidative stress is there, because of which oxygen supply to these particular centrolobular hepatocytes is decreased. Metabolism of ethanol via ADH or ALDH, which we have seen, results in shift in the redox state of the cycle, resulting, what is happening? There will be hyperlacticidemia, hyperlipidemia, increased lipid levels, hyperuricemia, hyperglycemia, increasing glucose levels, which will lead to steatosis and collagen synthesis. That's why our chronic alcohol consumption will lead to liver cirrhosis. That you have to remember. So stop here. Try to read this thing. What is exactly happening? Okay. This diagram, it is very clearly giving how the peroxy radicals are there, how the fatty liver is formed, how this particular different type of because of this oxidative stress, this free radicals are formed. Okay, so we'll see. I think we'll see. This is the last part. So we have seen the adverse effects of ethanol on fetus. We have seen on the liver. We have seen different metabolism enzymes. We have seen. Now how this is affecting alcohol having adverse effect outside the liver cells. That is how it is having adverse effects on the cardiac cells, we'll see. Okay, alcoholism can result in damage of extrahepatic tissue, means outside the liver. Okay, alcoholic cardiomyopathy. So alcohol is having adverse effects on the heart. So it is called cardiomyopathy. So what are the diagnostic features we'll see here? The complex process that may result from decreased synthesis of cardiac contractile protein. Heart, in order to contract, it continuously need calcium. Various mechanisms will be involved. So this particular synthesis of this, whatever the contractile proteins will be there, no actin, myosin, whatever, that will be decreased. Attack of this oxygen radicals because of the oxidative stress. Increase of endoplasmic reticulum calcium ATPase. So how we have in the case of skeletal muscle Na plus K plus ATPase, here in the case of cardiac cells we have the calcium ATPase pump will be there. Okay, antibody response to acetaldehyde protein headaches. Okay, heavy drinking appears to be deplete antioxidant and increase the risk of both hemorrhagic and ischemic strokes. So on overconsumption of alcohol will cause hemorrhagic as well as strokes. Ischemic strokes will be there. Brain and pancreas may be adversely affected in the case of alcoholics. Association between alcohol and cancers. How we are getting it? Based on epidemiological studies. So one topic in the exam you will have with respect to case control studies, cohort studies. So one question, retrospective studies, case control studies, cohorts, that you check. If you check in your brochure, it is very clearly given. So read those type of terminology. What type of trials are there? What are the trials type? But what the trials are inference in you? What type of results you are getting from this? That you have to read it. Okay, pause here, go back and read what is case control, retrospective studies, cohort studies. Then it is a frequently repetitive asked question in the ABT. I have seen ethanol and smoking act synergistically. So potentiation, synergistic, all this. So whenever an alcoholic person is also smoking, then you have synergistic effect to cause oral, pharyngeal, and laryngeal cancer. Alcohol induces liver cancer by causing cirrhosis. So fatty livers we have seen, hepatocytes, how steatosis is taking place that we have seen, and other liver damages by enhancing bioactivation of carcinogens. So those carcinogens which were in pro-carcinogenic stage, they also got activated and they turned into carcinogens. So chronic alcohol consumption may promote carcinogens. How the alcohol consumption is causing cancer, we'll see in this particular point. Production of acetaldehyde. We've seen this toxic acetaldehyde. It gets metabolized whatever ALDH enzyme which is there in our body. But overproduction, increase of this acetaldehyde in our body, it has adverse effects. So it is a weak mutagen. So it is causing DNA damage, and it is itself it's a carcinogenic. Acetaldehyde itself is a cancer-causing chemical. Induction of CYP2E1. So more excess of induction of any enzyme will have some adverse effects. So what it will do, it will convert pro-carcinogen into carcinogen. As I told you, depletion of SAM, that is S-adenosyl methylation. So hypermethylation is there. See, with conversion of pro-carcinogen, global DNA hypomethylation. Okay, CH3, addition of more methyl group, hypomethylation is um, less addition of this methyl group, hypomethylation to the DNA group. Okay, then increased production of inhibitory guanine nucleotide regulatory proteins, component of extracellular signal regulated kinase, mitogen. So this is the thing. Most of the anti-cancers belongs to the class of this kinase inhibitor, MAP kinase, tyrosine kinase inhibitor. So those particular things it is getting targeted, because of which excessive cancer is there. Okay, accumulation of iron and associated oxidative stress, because thymine is getting affected. We have seen pyridoxal phosphate, it is getting affected. So it is affecting vitamin A, the metabolism, all those things, because of which accumulation of iron and associated oxidative stress is there. Inactivation of this tumor suppressor gene, very important. So female, apart from fetal alcohol syndrome, all those things, there is a possibility of that they will be getting breast cancer. Why? Because BRCA1, which is a breast tumor suppressing cancer gene, is there, no? That it is causing, this alcohol is causing inactivation, because of which what will do, females are more prone to get breast cancer, and it's also increasing estrogen responsiveness, primarily in the case of breast. Amoxicillin, such a class of drugs will be there, no? They will be impairment of retinoic acid metabolism. Okay, so retinoic rods and cones, they are not just involved in this thing, only in the vision, in the ocular function. There are many roles throughout. So read this topic also in detail about retinoic acid, rods and cones, all these things. So hope from this video you were able to learn about ethanol, ethanol toxicity. We have discussed about frank toxic effects, severe type of poisoning, and psychomotor disturbances upon alcohol consumption. We have discussed about the adverse effects on the fetus, that is fetal alcohol syndrome and FASD. MEOS enzymes which are involved, CYP enzymes, aldehyde dehydrogenate, that particular enzymes, and the adverse effects on the liver, steatosis and cirrhosis. And we have discussed about cardiomyopathy and how the pro-carcinogens are converted into carcinogens. So these are the various things we had tried to cover about ethanol, which is taken from the Clayton textbook only, which is very important. Any question, see, they will ask you with respect to enzymes, they will ask you with respect to catalase or how the alcohol is metabolized, why the difference is there. So this type of frequently topic with respect to ethanol you will get in your exam. Okay. Hope from this video you have learned. Thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Thank you so much. All the best for your exam.